fantastic to see people pouring into wildlife trust sites, discovering the local wildlife trust down the road that they never knew about. It's been wonderful to see so many people logging on to the RSPB's big breakfast bird watch every day. And I hear that National Trust almost ran out of scones. The level of engagement with nature has been unprecedented. But one of the things that we talk about less on that side is how the richness of our natural environment is also really important for enhancing well-being benefits. It's not just about having a patch of grass down the road, it's about having a biodiverse, rich and accessible natural environment so that we can enjoy a genuine connection with nature. And we talk less about the disparities in access to nature. So at a time when some of us have been finding strength and solace in nature like never before, lots more people have found themselves disconnected from nature, with 2.6 million people without access to a garden in the UK, and lots of people in nature deprived environments finding themselves feeling more and more isolated by virtue of the fact that they haven't been able to get out into and access nature. And finally, we discuss less the overall crisis of our natural environment and how, unless we can stop the long-term relentless decline in biodiversity and nature, then its ability to support us all will be eroded. And the ecological crisis is one that requires urgent action from government, not just for its own sake in helping us to look after our wonderful natural environment, but also for the sake of the benefits that it can provide to people in supporting our physical and mental health. So those are some of the themes that we hope to discuss today in State of Nature, State of Mind, and to think through together what you and what we can do to convince government and our communities to invest in nature as part of our activities in looking after our mental and physical health. So I'm delighted to be joined by a fantastic panel this afternoon. First of all, we'll be hearing from Mark Rowland, who's Chief Executive of the Mental Health Foundation, who are organising Mental Health Awareness Week. From Mark, we'll turn to Dr. Becca Lovell from the University of Exeter Medical School, which is a WHO, a World Health Organization collaborating centre in natural environment and health. From Dr. Lovell, we'll turn to Dr. Khan, who's a GP, author and campaigner, as well as an ambassador for butterfly conservation and the wildlife trusts. After Dr. Khan, we'll go to Beccy Speight, Chief Executive of the RSPB. And finally, we'll turn to Baroness Parminter, who is chair of the new Environment and Climate Change Select Committee in the House of Lords. So we hope that you'll enjoy the discussion this afternoon. We hope that we'll all learn and benefit from it. And please do take time to comment and ask questions in the chat function as we go along. And after we've heard from the panel, we'll turn to you for discussion. So thanks very much again for joining us. And I'll turn now to Mark to give us an introduction from the Mental Health Foundation.
Thank you so much, Richard. That was a fantastic introduction. And wherever you're watching this, I don't know whether we're going global today or whether most people are joining from the UK, but whatever context you're sitting in or sharing this webinar, you're really welcome. And my job really, I think, is just to set out why we've chosen the theme of nature for Mental Health Awareness Week and some of the key findings that we have launched today with both our policy and research reports. So to stay with me, I'll try to make this, I'll do 5 minutes on the clock, and then I want to open it up to our other panel members. But why did we choose the theme of nature? And I think most of us know that nature is good for us, but our message this week is that the impact of nature and its role in our mental health and well-being has been underestimated. We have taken it too much for granted. And our message this week is that it's almost impossible to live with good mental health without a vibrant connection with the natural world. So if it's important for you and the people that you love to live in a way that reduces stress, that gets the most out of life, then it turns out a connection to nature is absolutely vital. So the evidence there we wanted to compile, and I'm sure we'll talk more about it. It turned out that during the pandemic, as Richard said, we've been running an ongoing mental health in the pandemic study, and that showed us that almost half of us had turned to nature during the pandemic. Walking in green spaces was a key coping mechanism for us. And in the work that we did for this week, 73% of people said that being in nature had supported them during the pandemic. And it was like there were little lights being turned on. When everything else was stripped away, we were left with the natural world. And at our most fragile and sometimes our most lonely, we were connecting with nature to bring us consolation. And there's just something that we felt was so important that we didn't lose that little epiphany of that opening up of our own souls to nature's gifts, and that we wanted to use Mental Health Awareness Week to try to share stories. And I'm really, really passionate about the fact that I believe that if we can get people's experiences, if we can use nature as a gateway to talk about what's happening in our own lives, this is another powerful contribution to why we need to take greater action to conserve the natural world. And it feels like there's an alliance here that we haven't fully explored that can save ourselves and save the planet. So for those reasons, it was really important to focus on nature. And you'll all be aware on this call that 2021 is a big year for nature and the environment in the UK, with COP26, with the G7 focusing on the environment, and with the Environment Bill. So it felt like a really important subject. The findings of our research were echoed really by what Richard said at the beginning, and that is that there is a really powerful link between our mental health and experiences in nature. There is a really clear association between experiencing and being connected with nature and reduced experience of anxiety, depression, and stress. So the mental health benefits are really, really clear. It's one of the most powerful, not just in preventing distress, but also in helping to recover if you've gone through a period of poor mental health. Nature is a fantastic healing agent. We found from the research that nature is also one of the biggest generators of positive emotions. And in particular, with the science of wonder, that the experience of the natural world is almost a unique contributor to that emotional experience of awe. And there's something about being decentered from our own lives that is powerful. When we step into nature, we get the right order of things. We see ourselves in our right place. And that isn't about undermining the importance of our own lives, but it is allowing the ego to step aside for a moment and allow the natural world to teach us something about our place in the world. There's something about the humility of that's tremendously important, that's tremendously valuable in bringing us stillness. And we also found that, and ironically, a real sense of purpose and meaning that nature brings, that far from making us feel small and insignificant, a connection with nature enhances our sense of why we've been placed in this world. And purpose is very strongly associated with good levels of mental health. So nature and mental health are strongly associated. I think the two other points I wanted to make were also what Richard made, which was that the evidence really showed that rich biodiverse settings for nature are better for your mental health. So there is, the cleaner and more abundant the natural world is, the more powerful its impact is on our mental health and well-being, especially over time. And that stands for a reason, right? If we're saying that it's our connection with nature that matters, it's not just being in nature, it's actually how we interact with it that matters, then it stands to reason that the better quality that natural environment is, the stronger the impact it has on us. And finally, we asked the UK public about access to nature, and we were shocked and maybe not surprised, but we found that young people now were 20% of young people were saying that they spent an hour or less in nature a week, sometimes no time at all. And when you know that the recommended sort of dosage is 2 hours a week, that was a concern. Minority ethnic communities cited that they were twice as likely to experience difficulty accessing nature. And that was to do with the experience or fear of discrimination. Sometimes it was to do with proximity. But that was a real concern. And people living with disabilities or physical conditions, again, 20% said that they were not accessing nature because of their physical liberty. It doesn't seem acceptable to us that because of people's physical conditions, we are not creating the space for people to enjoy and access nature, and that is a real concern. And finally, on the question of safety, 26% of women compared to 9% of men said that safety and fear of violence was a reason that inhibited them from accessing nature. There's so much that we've got to do, and until nature is a resource that's available to everyone, A, we won't protect it sufficiently, and B, we won't be getting the mental health benefits. So there's a set of policy recommendations that we're making for the week, but perhaps before I dive into that, I just open up for other panel members to also comment, if that's okay, Richard.
Thank you so much, Mark. That was a brilliant introduction, and we'll pop your research report link in the chat. And I think if everybody would like to look at it, it's a fantastic report, brilliantly laid out with some really clear findings from the public about their views about the importance of access recently, as well as some policy conclusions. And we'll go from your findings from your public polling to the rich academic set of work that has been developing in this area over a number of years. And Dr. Lovell is one of the pioneers in that field. So Becca, how are things looking from your work and practice?
I'm standing on the shoulders of many, many giants with what I'm going to talk about today. So thank you very much for having me. And Richard asked if I would talk a bit about the evidence base for the links between environments and health. So I thought I'd use my 5 minutes to give you a whistle-stop tour of what we know about the links between environments and health. And as I said before, I am standing on the shoulders of giants, and there is a long, long history of this. And you can go to the work of historians such as Claire Hickman up in Newcastle University, who's focused on how natural environments have been considered as both a threat, but also a resource for health throughout history. So we have this long understanding of the role of the environment, but actually it's only quite recently that we've started to quite systematically explore and understand what's going on between exposure to environments and a number of different health outcomes, and started to unpick some of those mechanisms of action. So we now have what's growing to be quite a robust body of evidence. It's very lively. There's a lot of work going on. And the evidence we have now is, it ranges from, really very big studies such as data linkages on whole populations, such as the study in Wales at the moment, looking at the links between the environments in which people live and common mental health disorders, led by Sarah Rogers and Rich Fry, through to really in-depth explorations of the role of and importance of nature in dealing with difficult life circumstances or things, or sort of transitions within life. So people such as Sarah Bell thinking about how nature can be a resource for people dealing with sight impairment, for instance. So we have this huge, rich body of evidence, which has started to try and describe the nature of relationships, but also unpick some of the ways in which nature relates to health. So I'm going to just run through some of that very, very quickly. But as Richard was saying and Mark was saying, that there are really good summary reports out there which go into this in much more detail. So in the last probably sort of 10, 15 years where this research has been really getting going, we found that the greener the environments in which we live in, the better the health outcomes. And that's at both population levels. So we see that communities who live in greener environments tend to have better health outcomes. And we see that for a range of different health outcomes, from physical health outcomes to mental health outcomes. We know that people who are active in natural environments tend to have better mental health. And that's where we compare groups of people who are active in indoor environments with outdoor environments, for instance. One of the most important and tantalizing pieces of evidence that we have from a number of studies now, both at big scale and much more local, is that we see reduced socioeconomic inequalities in health in greener environments. And this is sort of the holy grail of public health research at the moment, is how we deal with the differences in health outcomes we see between richer and poorer communities. And it's incredibly difficult to deal with because efforts to improve health can quite often exacerbate inequalities, that the people with more resources and more capacity to respond to health messaging pick up these messages and leave behind the people who have less time and less resources to respond. So this narrowing of health inequity in greener communities is one of the most interesting things that we've been exploring recently. We also sort of seeing and following on from that kind of theme, more equitable participation in health promoting behaviours such as physical activity in some types of natural environments. So in the coastal environment, for instance, we see the types of groups which don't tend to be physically active in other environments, older women, people with poor health, and some of these harder to reach groups are more active in these spaces. It's seen as a more attractive, more acceptable place to be. So another really interesting, tantalising sort of finding that we've got in the links between environments and health. And then finally, on that kind of theme, we found that certain environments seem to be protective of mental health. So when we look at the evidence about communities where we'd expect to see poor health, we see this interesting relationship. So some of those communities where you'd expect to see poor health, so associated with low socioeconomic status or post-industrial communities, for instance, those with good quality environments around them, in some cases seem to be buffered from those adverse life circumstances. So another really interesting, tantalising piece of evidence around the links between environments and health. We also know that when we talk to people about nature and health, they hugely value it. They want nature protected as a way of which to protect their community and families, and also the global population's health. And another reason we're very interested in nature and health is it's got incredible reach. Nature is all around us. It's a resource which most people in some way or another have access to. And there's not a huge amount of other public health resources such as gyms or libraries or so on that have that sort of spread across our population. However, I think Richard mentioned before, we know that opportunities and resources aren't distributed equitably. So we have big questions about how to make sure everybody can benefit from nature. One of the questions I was asked to think about was qualities of environments, and this leads to me my next sort of big area of our research is about what kind of environments matter. And here it's a bit horses for courses. Nature is all around us, and there's a bit of a danger that we tend to spend a lot of time talking about very specific types of environments. So in research, we talk a lot about urban green spaces. And on the other hand, we talk about special places. But actually, I think there's a need to pluralize how we think about nature and natural environments. It can be the dandelion in the pavement through to the national park. It all matters, and it all has a role in promoting our health. We also know that different types of environments have different salience and different affordances for different types of people. So what I mean there is that people value different environments for different reasons, and different types of environments afford different types of uses and ways in which they benefit health. But the quality of the environment is absolutely fundamental. We know that both the ecological quality of the environment has links with ecosystem services, which I'll talk about in a moment, but also the social quality of the environment is really important. And we know that perceptions of environments are really the key thing here. So if you feel like the environment is well looked after, so you can see lots of species of butterflies and birds and so on, and also that it feels well cared for, that other people respect it and are looking after it, those are the kind of conditions where we see better health outcomes. And my final point about the kinds of environments, we spend a lot of time thinking about public spaces, but actually private spaces and gardens are incredibly important. It's often the place in which we first encounter nature as little babies, when we're put on the lawn and we play with a dandelion or a little ladybird. And I think we forget about this quite often in policy discourse about the importance of private space as well as public space, because they have different roles in how they promote health. We spend a lot of time thinking about how nature relates to health, and there's a lot of different mechanisms going on here, and particularly for mental health. It's restorative. We know that people who are going through very, very stressful life events, often they seek out calming, restful, green spaces. We also know that natural environments can help build capacity and help build resilience to adverse life events. And it also facilitates a number of sort of intermediate pathways, such as being physically active, sort of encourages social contact, and can provide space for cultural activities as well. And then all those individual sort of ways in which nature relates to health sit within much bigger processes. So at the community level, we know that better cared for environments which are greener are very strongly related to better quality of life. And greener environments mitigate some of those other things which cause us stress, so particularly environmental risks, so air pollution and noise through to flooding. When we're thinking about green infrastructure, for instance, there's multiple ways in which a tree on a street can benefit people's mental health. And then that sits within the very big global ecosystems, where we think about the connectivity between all the bits of green we have in our environments and how they all work together to underpin the very things which make our existence possible. So very quickly, I'll finish up with just talking about where all this evidence has taken us. And we've got to the stage now where I go and do talks and people say, so what? So what do we do? How do I make use of nature to promote people's health? And this is sort of manifest in lots of different ways. One of the really key things at the moment is around the idea of green social prescribing and this sort of instrumental use of nature in promoting health, but also dealing with poor mental health or mental ill health. And there's a huge amount of interest in this at the moment, and it's sort of catching up a whole load of activity which people like the RSPB and Wildlife Trust have been doing for years, but within a very definite framework. And the government's invested just under 6 million, I think, in trying to work out how to do this better. But the really interesting thing about green social prescribing is it has these multiple co-benefits that I was just talking about before. So if you get a group of people to go out and do conservation volunteering, it has benefits for that group of people. They're active, they're in a social group, all sorts of ways in which they benefit mental health. They're improving that community's local environment. You know, they're doing something for their community, it's valued, they're, you know, tidying up paths, whatever it is, but also contributing at that global scale as well for the ecosystem services. And I was trying to think recently, there aren't many forms of social prescribing or that kind of therapeutic activity which have that sort of breadth of benefit to the individual, but also to the community. We're also really interested in how we improve our environments equitably. So here there's huge amounts of interest in green infrastructure and nature-based solutions, both to deal with the threats to our health from the environment, but also how we create spaces which are health promoting, and we're trying to avoid those inequities of green gentrification and LULUs, or locally unwanted land uses. And then finally, my final point is there's a lot of interest at the moment in younger age groups and how we represent and think about the needs and interests of future generations and how we think about their mental health. The Royal College of Psychiatrists, for instance, are very interested in how they deal in the here and now with the environmental distress and eco-anxiety of children and young people that is becoming quite a key thing that they're seeing quite regularly, through to what's their role in trying to address climate change and change attitudes and so on. So that's my very quick whistle-top Gubbles tour of the evidence that we have at the moment, and I can send some more links if anybody's interested in following up this, but thank you again for having me.
Thank you so much, Becca. That was brilliant, and particularly interesting to hear about the sort of virtuous circle of treatment contributing to community and helping to sort of repair some of the disparities that are causing the trouble in the first place. That's fascinating, and I hope we'll return to that in discussion. We'll turn now to Dr. Khan, who is Ambassador for Butterfly Conservation and Wildlife Trusts, as well as a GP. For anybody who follows Dr. Khan on Twitter, they'll know that he daily prescribes doses of nature free at the point of Twitter, and is spreading the nature love regularly. But Amir, it would be great to hear what your experiences have been in the NHS of whether these messages are starting to get home with GPs, with patients. When did you last write a real prescription slip that had therapy on it?
Oh, well, hi everyone, my name's Amir. I'm going to start off actually by telling you how nature has helped me recently from a mental health point of view. Like lots of people in the NHS, it's been a really tough year. And I remember at about this time last year when the pandemic was really taking off and there was a lot of worry and concern about it. It continues to be, but when it was really starting, I was working in what we call red hubs, where patients who had things like a fever or a cough we hadn't discovered the sense of smell and taste at that point, were being kind of directed towards these sites, so patients with non-COVID related symptoms could be seen at their GP surgeries. And I remember thinking at the time, I was dressed in PPE and seeing these patients, and I was really, really concerned, really stressed about catching the virus, bringing it home and taking it to my family. And it was a really stressful time, I'll be honest. It was scary, it was very, very worrying. And then at the same time, I was going into care homes to see patients with COVID-related symptoms there, and sadly, we had many of them pass away. And I've got two parts to this, really. The first one was at when I used to come back from the Red Hubs, the first thing I did, because I don't know if you remember, but the weather was really, really nice at that point of the year. We had unseasonably warm weather, and people were taking to nature, as being discussed here. And I remember coming back very just anxious, and I'm lucky enough not to really have suffered from serious mental health issues prior to this. And we were just learning about people from minority backgrounds in particular being more effective, more at risk for a variety of reasons. And so each time I'd come home thinking, gosh, have I got this virus? Is it really going to be bad for me? Is it going to be bad for my family? And the first thing I do before going into the house was to go into the garden. And as Becca says, these private garden spaces are so important for us and for wildlife. And I would take half an hour or so just watching the birds on the feeders, watching the insects buzz around the garden, and it really centered me enough to be able to go indoors. I also had to have a full body wash outdoors before I was allowed inside as well. That wasn't my decision. That was the other half. And it did really make a difference. And there was another time that I talk about quite a lot, but it was so important to me, was when I had come out of a nursing home. A patient had sadly passed away from COVID. I'd been over to certify the death, and I was going back to the surgery, and I had to ring the wife of this patient up, and I remember sitting in the car, because when you're a GP, I've been working at the same practice for 12 years, and you get to know your patients, and particularly the ones in the nursing homes, because they're the ones who need you the most. You go there very often, you see them more often than the younger patients, obviously. And sitting in the car, very upset because this patient had died, and perhaps unnecessarily. And the thing that drew me out of that moment was watching a robin kind of go back and forth into a hedgerow, building a nest and taking nesting material from wherever it went to get it back into this hedgerow. And that really brought me out of that. For a few minutes, I forgot what I just experienced, and it brought me back into where I needed to be, so I could make that phone call to that patient's wife. And prior to that, I've known about the well-being effects of nature, but I really experienced it firsthand during this last year. It's been incredible for me, and I know it's been incredible for many people who have been stressed through what's been a really tough year. So I do want to talk about it from a health point of view, because I do work as a GP. I work in inner city Bradford. It's a very socially deprived area. It's a very diverse population that I serve, and I love working there. But those are the people who really stand to benefit most from accessing nature, and that applies to all kind of inner city areas. Often the people there have other comorbidities, other health conditions, which may put up barriers to them accessing nature, as well as things like Mark talked about, people from minority backgrounds being less likely to access nature, and people from socially deprived backgrounds as well. And I'm sure Becca knows that the people who access nature the least stand the most to benefit from it most. And we talk about it from a mental health point of view, but it's difficult to separate mental and physical health out, really, because the two are so interconnected, and anyone with any kind of chronic physical health condition will know that it has an impact on your mental health very, very quickly, and the longer it goes on for, the worse that effect can be. And nature actually, can benefit both of those things, your mental and your physical health. It is critical to health, happiness, and prosperity for all people. And there's so much evidence behind that. Becca's touched on a lot of it. And when I talk about, what's really important but really hard is convincing patients who haven't had access to nature, don't really know about the importance and the healing effects of nature, to go out and experience nature as part of their treatment. And they think I'm a bit woo-woo, to be honest, when I talk about it, because they are often, like you said, they're expecting a written prescription of some kind of tablet or medicine, rather than some advice or a prescription about going out. And I do physically at times write it down on one of those green pieces of paper that you write on prescriptions, an hour a day or half an hour a day, to add up to those crucial 2 hours or that they need each week, just as a way of really hammering it home for them. But all these chronic health conditions I've talked about, things like type 2 diabetes, cardiovascular disease, premature death, preterm birth, stress, high blood pressure, all of these things stand to benefit from time in nature. You can reduce your risk of developing them, but also improving the management of each one of those things through time with nature. And we talked about the physicality of it. The things like stress hormones, cortisol, are reduced when we spend time in nature, and that is good for things like depression, anxiety, and stress. Our happy neurotransmitters or brain chemicals go up when we spend time in nature, and this can be demonstrated. I know there was a study where people were put in something called a functional MRI machine, where we can see where parts of the brain light up when you experience certain things, and they were shown images of natural environments, green spaces, and the parts for happiness and love lit up, whereas when they were showed images of urban environments, actually the areas that are connected to fear and anxiety and stress lit up as well. So I think that says a lot. And part of our well-being, as it is Mental Health Awareness Week, is connection with other people and getting to know other people and talking to other people and communities. And Becca highlighted that really well when she talked about how important these kind of outdoor workshops can be. And again, there are studies that show people who have access to green spaces, or a neighborhood with access to green spaces, they have better connectivity to their neighbors as well compared to those who don't. And that is really important to your mental health. So there's so much evidence behind it. It's all about making sure people can access it. But it's one thing accessing it, but we've got to convince people that it will work for them as well. So there's a kind of a two-pronged approach to it. And where everyone in this meeting now are all very like-minded. We enjoy nature. The reason we're here is because we love nature. We know about the benefits, but there's a whole host of people who are not here, who wouldn't think about attending a meeting like this. And those are the people we need to target, really. And that will involve schools, it will involve parents, it will involve older generations, it will involve looking at the different ways to target minority groups, because they will respond to different messaging and different approaches. And it's about convincing people with long-term health conditions which prevent them from leaving the house to leave the house. And that's a difficult thing to do as well. But it's all about equity. When you work with these people, when you see actually, conventional medicine is really important, but it can't be the only thing that we use to manage these conditions. That's where it becomes a sticking point for me, I think. And that's why I became an ambassador for the Wildlife Trust and the Butterfly Association, because I don't see many people who look like me talking about this stuff all the time, and I think that's super important. But also, I grew up socially deprived. I grew up in inner city Bradford. I grew up without a garden, so I know what it can feel like to be marginalised and how hard it can be to take that first step into nature, but how much you can benefit as a result. Yeah, I think that's I've probably reached my time limit. I'm sorry if I've gone over, but that's the end.
It was worth every extra minute. Thank you.
Thanks.
And we'll turn now to Beccy Speight, CEO of RSPB, who are addressing both of those practical challenges that you give in terms of making sure that we reach out to people to teach them about the benefits of accessing nature, but also to make sure that, frankly, there's enough nature there when people go looking, which is a growing part of the challenge, isn't it, Beccy?
Yeah, absolutely, Richard. And I was really interested, Amir, in what you were saying about what you did to kind of de-stress. And I certainly, I don't have days anything like as stressful as yours, but I'm very aware that, you know, even when I'm working from home, at the end of the day, I go out and I lie on my lawn in my garden. And I just want to feel that connection to a turning planet underneath me, and to kind of hear I've got a nesting box full of great tits at the moment. I just want to hear them cheeping, and I want to check out the tadpoles in my pond, and you know, it absolutely does it for me. So, you know, anecdotally, absolutely. And I was really interested, just today actually, I was reading a piece in a newspaper written by Ben Watt, who is part of, if you're my age, you remember Everything But the Girl, who were a fantastic pop band, and or still are, and he was writing a lot about his experience during lockdown. He has a kind of a disease where he suffered from a disease that really affected his immune system. So, you know, lockdown was very, very severe for him, and he started going out and walking to Welsh Harp, which was a local reservoir where he lived in London. And not only did he kind of, you know, having been a member of the RSPB, I think since he was 7, he said, not only did it kind of, you know, absolutely provide him with that kind of solace and that kind of sense of being good for his mental and physical health, but he then got really passionate about the state that Welsh Harp was in. It was kind of, it was full of rubbish, basically, which was really kind of damaging its status as a site of special scientific interest, particularly for birds. And so he then kind of galvanized this whole kind of volunteer activity. He started a campaign. He got kind of, you know, bodies from the Environment Agency to local authorities involved in doing their bit. And he's kind of transformed the state of that site now. And I was just really interested in that intersectionality between kind of, you know, his own benefits to his own kind of mental and physical health, but then really wanting to do something to ensure that kind of the state of nature was improved in that place where he had really got that from. And it was just a really fantastic kind of case study. And I think that intersectionality is where I think it's so interesting, you know. And we know, for example, that, you know, COVID was caused basically as a disease by us pushing back too hard on the natural world, you know, and letting kind of this kind of disease jump into the kind of the human species. And we also know that, you know, certainly during lockdown, you know, people have felt this kind of huge benefit from being reconnected to the natural world on their doorstep, getting out and doing that kind of, you know, mandated hour of exercise in their local kind of area, and really noticing nature, sometimes for the first time. And we've certainly done research that's shown this huge wealth of evidence about how important that has been to people during lockdown in terms of their mental health. And, you know, I was interested that Becca, you know, mentioned that kind of the Royal College of Psychiatrists and that report that's just come out. And I kind of wrote down this great quote from the president saying, you know, we have no choice but to join the voices of those who are calling for urgent action and declare a climate and ecological emergency to avert a health and mental health catastrophe. So that kind of intersectionality of the kind of the catastrophe we're seeing in health and the catastrophe in terms of the climate and the natural world just feels absolutely there. And I see it in people who work in my own organization, who are kind of working right on the front line of what's going on in terms of the climate and nature crisis, and they do suffer from kind of eco distress, you know, nostalgia, all these great kind of terms we've come up with to describe how tough it is for those people who are really working to try and avert this, and what it does to them in terms of their own mental health. So it kind of, that intersectionality works on so many levels. We've had some great evidence come through in terms of what Becca has said, Mark, Amir, in terms of the kind of evidence there is around access to kind of nature-rich green spaces, and how important that is. Amir mentioned that magic kind of 120 minutes. That seems to be the thing. So if you've only got 119, you've got to get out there and get another minute, because it seems to be 120 minutes a week is what you need in order to feel the benefit. But those huge inequalities that exist in terms of how people are able to access nature-rich green spaces and find that benefit. And we were talking about the kind of the barriers that stand in the way of that. Some of them tangible, some of them less tangible. But we know that people in UK households who have an income less than £10,000 a year are 3.6 times more likely to have no outdoor space to get into, and 40% less likely to live within 10 minutes of a public green space than those who earn more than £60,000. So that kind of income inequality it seems to be a huge factor. And we know from the evidence we've collected, how important it has been during COVID to get out into those green spaces and to really feel the benefit of it. I think as an organisation, we absolutely believe in the intrinsic value of nature. So our vision is for a world that is richer in nature, but also a world where people live in harmony with nature. And this sits particularly in that piece for us. But we do know, and the natural world is in a lot of trouble at the moment. So in the UK, we've got all the evidence to show that we think species have declined since the 1970s, and we use that because that's when we first started monitoring properly. Decline is about 41% in terms of species. And I think for me, it is not just about extinction. So we are losing some species, and we've got 1 million species at risk around the world at the moment, but it's absolutely about abundance. And I think abundance feels very important in terms of this conversation. So it's kind of what are you able to see on your doorstep, and how much of it are you able to see, and how easy is it to see it? And that feels really important. I feel certainly in my own kind of experience, that has really changed over the last I'm 53, and I feel like that's just absolutely changed enormously since I was a kid, when I could see nature very easily around me, and now it is much harder to see because of that abundance issue. So what do we do about that? Well, we know that actually what we need is kind of absolute legally binding targets to turn that around. So we've learned from the kind of the Climate Act and the work that's been done around climate, that is what will really drive change. And we know that without that, what happens is, governments make great promises, great pledges, but then actually don't take the action that they need to take to make that difference. So, looking back on some of the targets that have been set for nature's restoration over the past kind of 10 years, we failed to hit kind of 17 out of the 20 targets that we set ourselves around that. So we know that without that we don't succeed, which is why the Environment Bill is so important at the moment. It's just been announced in the Queen's speech. It's coming back. It's been delayed for a long time, and it's why we are really pushing to get this amendment to the Environment Bill, which will mean that we set legally binding targets, which says that decline that I talked about gets turned round, and it gets turned round by 2030. And really without that, it will just be more fine words. And that is why this intersectionality, this is not just for the benefit of species, this is for our own benefit as well. And unless we absolutely get that nailed down, we know evidence shows that it will not happen. So that feels incredibly important. And the second piece is value, and whether we've all the evidence is there, we've talked about all the evidence, but do we really give value to it? Do we really value nature for what it gives to us? And luckily there is now good thinking coming through things like the Dasgupta review very recently, which really says to Treasury, actually this has a monetary value, and this is of value in terms of what it brings to the human species. And I think getting that kind of value recognised, getting some of those legally binding targets recognised, is what will really stand us in good stead in terms of making the difference. So all I can say is you might think that the Environment Bill has little to do with you, but I would say it absolutely has. And if you can kind of support the push that we're doing at the moment around getting this State of Nature amendment into the Environment Bill, it's got absolutely huge kind of meaning for the kind of intersectionality we've been talking about today. So I do urge you to do so, because without the natural world we will be in deep trouble.
Thank you so much, Beccy. That was brilliant. And you know, we often hear environmentalists getting across that we're instrumentalizing nature for the benefits it brings through the ecosystem services side of things. And on the other hand, we often hear people to whom we talk about access to nature saying, well, you only come to talk to us about access to nature when you want to recruit us in your ecological rescue efforts. And one of the brilliant messages I think you articulated there, Beccy, that comes through really strongly in Mark's report is about that mutual dependence and how we're never going to solve the mental and physical health crisis unless we look after nature, and we're never going to look after nature unless we bring everyone with us. So that mutual interdependence is really important. Having said that, I've naughtily put our link to our petition for State of Nature targets into the chat. And if you haven't signed it yet, please do. So that brings us to Baroness Kate Parminter, Chair of the Environment and Climate Change Select Committee. And Kate, we've heard lots about some of the interventions that are needed to help us maximise people's benefits from nature. So bringing nature to your doorstep touches on planning policy. We've heard about young people and the need to teach them early about nature's benefits, and that touches on education. We've heard about some of the difficulties of social care and the NHS getting involved in these areas, so health policy. There is a whole world of policy change needing to take place, isn't there, to help us both to protect nature and to benefit from the value it can give to folk. What's your position on how government's doing, and where do you think that we ought to be looking to press government to do more on this agenda?
Thank you very much, Richard, for that introduction, and it's great listening to all my fellow panelists. Given my role in the House of Lords, you're probably not surprised to hear that I'm delighted to be here today, but also I'm delighted because our daughter suffers from an eating disorder. So I know personally how important nature is to people who suffer from mental health and those people who love for them, care for them, and indeed worry about them. But I'm going to talk here about the policy context to the issues. And as has already been mentioned, this year is a major opportunity to reset the dial for nature. The COP15, not the COP26, but the COP15 in October is the opportunity to really get the ambition right for nature recovery, to reset the dial for nature. And as Beccy said, we need the UK to be leading from the front. We've learned from the climate change agenda that we need legislation firmly in place. And so whilst I welcome very much the government's commitment and its championing of the High Ambition Coalition for Nature and People, it really must cement its commitments now into legislation. And as Beccy said, we've had the Queen's speech today, bringing back for the third time the Environment Bill. The government has proposed amendments to it, but it has not proposed amending it to include this legally binding target to reverse the loss of nature by 2030 in England. And I applaud the work of the Wildlife and Countryside Link and all the organisations who've been pushing for that. And I and other parliamentarians right across the House, certainly in the House of Lords when it gets down our end, probably next month, will be pushing hard to get that target in the legislation, and indeed for a really strong Office for Environmental Protection to hold the government to account. That is a critical building block for our nature in the future. But if we're going to get the benefits from protecting our nature and to get some of those benefits that Amir and Becca and Mark have mentioned, those benefits for people, then we don't just need strong nature policies which will protect and restore nature. We actually need better policies around access. And I was reminded of that very forcefully when Rose and I yesterday were walking in Winkworth Arboretum, which I would defy anyone to say is not the best place in the world to see bluebells in the spring. And we were just reflecting on how wonderful it was to be able to have that moment of peace and escapism and true wonder, which is, I think, a word that Amir mentioned, wonder at nature. And yet, and the stat I like to reflect on is only 1 in 10 households in the UK have their own private garden, and that number drops to 1 in 5 in London. So this issue of access and the government really focusing on access to nature is one where I think we need to see more policy progress. It was good to hear in the Queen's speech today that the government are going to bringing more measures to improve mental health. That's great. And as Becca said, I mean, the government are spending some money on green social prescribing. It's only 7 pilots though, and we need that rolled out to every single clinical commissioning group in the UK. But I believe there's much more the government could do as well. For a start, it could set targets for people's access to nature. Becky mentioned the Environment Bill. That's about setting future targets around the environment. It would allow the government to set a target for access to nature, but in the list that the government has produced to date, there is no indication that they intend to do that. Secondly, we've had no proposals as yet to improve urban green infrastructure in terms of building back better from COVID. We've had really welcome commitments to put money into farming so that they deliver public goods for public money, and money to go through the Nature for Climate Fund so that we can plant more trees and protect peatland to suck up carbon. There's been nothing specifically on urban green spaces. And I would like to, I applaud all the work that the RSPB has done, and indeed the Wildlife Trusts in this arena around green social prescribing and nature protection. But I would also like to put in a word for the National Trust and their fund, which they have proposed for urban green infrastructure, which was about levelling up access to nature right across the UK. And finally, as Richard mentioned, we've had the planning reforms mentioned yet again in the Queen's speech today, and it's framed very bluntly, where it's all about building more homes. And once again, DCLG seems to have missed the memo that when we're talking about building people's homes, it's about ensuring that those homes are in nature-rich environments and that deliver all the benefits that they need. So, the government is doing a lot, but it could do a lot more, and it could really make 2021 transformational. It just needs to use all the policy levers at its disposal, and making sure that the policy levers really reflect why nature is a benefit to people in all areas. Firstly, it's obviously important in terms of delivering on the net zero agenda. Of course, we need that. It's also important on delivering for people's physical health, with all the ecosystem services it provides. But we need more action to ensure that they're also doing policies around improving access to nature-rich areas, because that's the third linchpin to ensure that people can benefit for their mental health. And we can really have a country that is building back better after the COVID pandemic. Thank you.
Thank you so much, Kate. And it's always good to hear fair assessments that recognise where there's good happening, but keep pressing forwards to show where there are still gaps. And I think this is such an emerging agenda. It's incumbent on us all to make sure that policy is keeping up with the speed of research and insights that academics and Mental Health Foundation and the charities are bringing forward. So thank you once again to all the panelists there for brilliant contributions. We'll turn now to some discussion, and I'm really pleased we've had plenty of questions in advance and in the chat function. Please do pop extra questions in chat now if you would like to. One from the email in advance, first of all, and this is from Wendy Hodgkinson, who asks, here in Derbyshire, where I work as a suicide prevention facilitator, we're so blessed to be surrounded by nature. How can we encourage those in inner cities and deprived areas with no access to nature to be encouraged and able to get out and enjoy nature? So I think this is the question back about enhancing urban nature and about making sure that we deal with some of those inequalities that we heard about earlier. So I'll turn back to you, Mark. You have published a policy paper, so it'd be great to hear what you think about this.
Yeah, and we've come up with sort of 6 key pledges which we are going to be pressing parliamentarians tomorrow, and one of them is about the fact that nature is not just the countryside, and I think we've all just had a conversation around how we can stimulate the debate between the intersection between local authorities, local communities, civil society in building up nature-rich environments in the urban environment. And we've got some international examples of countries that have done that. I spent some time in Singapore as a city-state, and it is possible to bring nature into urban settings. And the point was made around suicide prevention. And I think this is where it's so important, because the government has started to make this shift. Because in mental health, there are two big challenges that we face. One is to ensure parity of esteem with physical health, so that people can access adequate, human-centered, compassionate, and effective support when they need it. And we haven't quite got there. But the other is around how we build a society which is preventing distress as much as possible and preventing people reaching points of crisis. And you know, in terms of suicide prevention, the government's plan, it does have some funding. It is starting to think about the cross-government commitments. And for us as the Mental Health Foundation, we're really passionate because we think the big gains in a mentally healthy society are all outside the health service. The big gains in terms of a mentally healthy society, and one of those is the roles of local authorities in building up green, in building up sort of green capital in an urban context. So yeah, I think the heart of the report, and interested in other people's comments on this, is that we want to build in the connection with nature, not just the time in nature. And there is some concern around the dosage approach to nature as not necessarily fitting with where the evidence is at, which is actually small connections with nature that are high quality can be just as effective for your mental health and well-being. And so we would like to see within the green prescribing pilots, for example, that they are really using as a metric, how does it affect an individual's understanding and emotional attachment to the natural world? And that connection as a key outcome measure, as a proxy to the impact it will have on mental and physical health. And then on local planning, I think our recommendation in the report is to say, look, we know that there are key junctions around the social ecosystem in urban. Where do people queue? Where do people congregate? Not so much now, but when we get back to normal in those spaces. And then let's think through how we can bring nature to those places and strengthen the connection with the natural world. So that's you know, I think really important. In terms of suicide ideation, I think it's or suicide prevention, the benefit of connecting with nature is breaking through the sense that you are alone and that you are trapped. And that's why connections with nature can pierce through those acute periods where the clouds of despair have really started to build around us. And there isn't a silver bullet. Of course, it's not going to mean that nature is going to solve everyone's problems. But if we were starting from the position of how we built societies with our mental and emotional well-being in mind, you would then plan an urban environment which absolutely brought nature into the heart of our lives.
Thank you, Mark. That's really useful. And your points about things like queuing and things, it sounds like the planning bill that was also announced today is going to be rich territory for making sure that we don't just try to bus people off to the countryside, but that we actually build nature into the fabric of our communities and think intelligently about how we can get green ribbons through and green corridors to make sure that we access those hardest to reach corners. I want to turn now to questions from Charlie Miller and from Dylan Underhill, who pose some challenges in the chat. So Charlie, who I think is Charlie from A Focus on Nature and has been doing brilliant work on connecting young people with nature. Charlie says that in a course that she's been doing, there's a suggestion that quality of green space, time and nature and socioeconomic status don't directly link to nature connectedness. And on almost the flip side, Dylan says that he's seen some research that says that prescribing nature doesn't have the same positive effect as organic connection and self-motivated connection with nature. So it sounds like there are still quite a lot of complexities. Is it as good to watch David Attenborough as it is to go down and dig on your allotment? Becca, help us through this tricky bit.
I'll try. I will preface this with I'm no expert in nature connection. So what I was mostly talking about today was health outcomes, so mental and physical health outcomes. My understanding with Miles's research on nature connection, that's about a personal relationship and with nature, and an understanding of your as a human's relationship in terms of how whether you're part of nature or distinct from nature. There's one of the scales has a lot of little dots that come together, so when they overlap you are part of nature, but if you're far away you are distinct entities. And with nature connection we talk about states and traits, and typically we talk about traits, so the way in which we feel our identity is in terms of nature connection, in a connection to nature. And what I think is probably that's about is that we don't see a very strong relationship between the amount of time you spend in nature and the types of places you spend in nature and those nature connection traits. There's a lot of interest in whether we can provide certain types of experiences of nature, encouraging nature connectedness as a sort of virtuous circle of helping people care more about nature. But we don't know a huge amount about that yet. The directionality of those two things is very difficult, and how you unpick the directionality is the important thing there. So whether it's your nature connection sort of determines whether you spend time in nature, or whether spending time in nature determines your connection with nature. If I've explained that right. So there's lots of different things going on there. The work I was talking about was, the sort of the next stage of how that manifests in actual health outcomes, whether it's mental or physical. And I think the comment from Dylan might be the fault of one of my colleagues. Matt White, possibly this is what this is about, published a paper recently looking at the relationship between time spent in nature and a number of different health outcomes, and particularly anxiety. And in that survey, they asked people about why they were spending time outdoors. And I think what they were finding was that people who had anxiety and other common mental health disorders were hearing, you need to go outdoors, you need to go and spend time in nature, it's good for you. And actually that was quite counterintuitive. They were feeling pressured to do something they thought was good for them. And it relates back to the previous question about suicide prevention and nature. We have to be very, very sensitive about how we promote nature. It's not a place for everybody. Lots of people, I think Amir was talking about this to start with, that feel, it's not a place that they have a connection with, a cultural connection, and they feel quite frightened about it. They don't know what to do there. And I think Mark was mentioning about the relationship between gender and nature. We have to be very sensitive about how we promote spending time outdoors and nature as a setting for mental health promotion. And we see that coming through some of the green social prescribing development, that sensitivity and the nuance in what you do and how you promote the role of nature is becoming incredibly important in what we do, as this becomes a much more prevalent way of trying to address some types of mental health disorder. And I think this is where some of the questions about how we might want to use nature as a way of addressing mental health becomes really important. Are we talking at an individual level, or are we talking about community assets and just quality of life and the general state of the places that we live, and allowing people to find the way in which they want to have a relationship with nature? So I think that's possibly what was going on with those two comments.
Thank you. That really helped me. And I guess the message that you want to try and improve the aggregate baseline for everyone, as well as being more targeted for individuals, is a helpful one for us to remember. This has brought back wounding memories of the first time I tried to talk to a politician about how even a pot plant at home could help. For the next, every time I saw this politician until he was unelected, he did this to me to sort of symbolize pot plant and would never listen sensibly about nature. So it was a bruising memory. Amir, I think you wanted to come in on this question.
Yeah, just briefly, Becca said a lot of what I was going to say. I think when we're looking at mental health and nature prescribing or green prescribing, we've got to remember that it is one aspect of the management of someone's mental health. So often they will be on medication, they might have talking therapy, but it may be alone, but more often than not, it's in addition to the treatment that they're already on. And so it's important to look at it holistically, and Becca alluded to that in that answer. But we've also got to be mindful, we all know about the benefits of nature. And yes, when I'm talking about green prescribing, it's not a case of you have to do this and you have to do that. We've got to be mindful that some people, through no fault of their own, have no idea that nature can be beneficial to their mental health. And so as part of that green prescribing, it's about giving them the information that a lot of us have, that in the know have, but they don't. And so it's not a case of just telling them what to do. It's the same as if I was telling someone about why their blood sugars are high or something like that. It's a case of giving them the information and then allowing them to make the decision about what they do with that information. And so it's not, like I say, it's not a case of you must do this, you must do that. It's much softer than that when we do green prescribing.
Thank you. That makes a lot of sense. And I hope we've helped Charlie and Dylan. There's a theme coming through in the questions, as often there is at this kind of webinar, about so what next? So what should we do? So we're coming to the end of our time now. So I'd just like to return to each of the panelists in turn, giving Beccy and Kate a little bit of extra time to tell us, what do you think that the people on the call can do to help to get word out there for Mental Health Awareness Week and about the importance of this agenda? And since we are a policy-focused organisation, what one thing should we all be asking the government to do to promote connectedness with nature for the benefits of mental health in the year ahead? So I'll ask for lightning contributions from Mark, Amir and Becca, and then we'll turn to Beccy and Kate after that, if that's all right. So Mark, let's pose you the challenge first. What should everybody on the call do? What should the government do?
Right, I'm going to go with everyone on. I think everyone on the call. I think Amir is right that the message that nature is good for your mental health is something that I don't think we should underestimate. It's so simple for those of us who are kind of converted to the cause, but let's be evangelists for that. Even for me, I don't feel like I have been awoken to, awake to nature's power on mental health. I went for a run yesterday, and by the way, Lady Parminter, I live by Wentworth and I love the bluebells. I took an absolutely lovely photo of the bluebells there, and I went for a run this week. I saw 3 woodpeckers for the first time. 3 woodpeckers. They literally came and they said to me, "Thank you for raising nature." It's really, they came their little act of gratitude. But so I think we just got to keep. I think we've got to keep making this message and ensuring that it isn't prescriptive, but it is inspirational for people, and that we're giving people an understanding of exploring what that connection might mean for them in the many different ways. The policy suggestions, I'll leave my one that I will leave the others, because I really think it's important that we focus on the Environment Bill. But outside of the Environment Bill, building a lifelong relationship with nature through the education system and seeing how we can weave nature, not just nature content in the curriculum, but the way in which kids are taught to interact with nature, I think could be a game changer, and I think could also ameliorate some of the climate concern and anxiety. So helping our kids to fall in love with nature is great for them, and it's great for the future of our planet in terms of they're going to be the people who will take the fight forward for a sustainable future.
Thanks, Mark. And that addresses some of David Jackson's questions, which was about Mary Colwell's campaign for a nature GCSE, and a really important thing to underline on this call. Becca, we've got 4 minutes left, so lightning fast if you can.
Mine's not going to sound very exciting either. My suggestion is so many of the things which will affect how the environment influences our health are upstream factors, and by upstream I mean policy upstream. It's about the planning bill, it's about how the government responds to climate change, it's about how education policy is put together. My one suggestion is to pay attention to that and to write to your MP, get involved in local politics, and think about the weight of voices coming from the population about that this matters to them, and get it on the agenda, get it into people's minds that this matters and it's something that their constituents care about.
Thanks, Becca. Get campaigning, great message. Amir?
Just very quickly, what I would recommend everyone to do is focus on the detail of nature, because it's so intricate and beautiful in its detail. And also I would recommend talking to animals. I talk to animals and plants all the time, and I think it does me wonders. And then on a larger scale, I would really, really want to see greener spaces coming into inner city areas to benefit those who stand to benefit the most.
Brilliant, thanks, Amir. Becky, I bet Mark's woodpeckers might have been great spotted. One of them might have been a green, but I bet there wasn't a lesser spotted in there. Does that matter?
It does matter, of course it matters, Richard. So I mean, I think the first thing I would say is we work at both ends of the telescope as an organization. So at the kind of the micro individual scale, I'd say everyone on this call now should get out, go for a walk, get off this call, go and kind of experience some nature yourself, then come back and sign the petition to get that state of nature amendment into the Environment Bill. Those are two things you could do tonight, which would be brilliant. And then in terms of what the government needs to do, I think it needs to get us as a society to a state where we can self-dose around nature. We don't need prescriptions. We know how to look after ourselves and how to self-dose, and that is about kind of access to it, more nature, so we get more access, building understanding through the kind of education system, and really making sure that we value nature properly in the decisions that we make. So that's what I want the government to do.
Thank you, Becky. I'm sorry to squeeze the time, but I'm enjoying the sense of urgency. Over to Kate.
But just briefly, if I just do on the Parliament what I think government should do. Yes, we absolutely have got to get this target for nature in the Environment Bill, because if you get a target, that then cascades down right across government, and it can lead to change in the health department, the education department, in DCLG. That is the fundamental building block that we have to get the government to agree to. And the other fundamental building block we have to get them to agree to is to respond urgently to the Descopter review, which Becky referred to, which is about finding a way to embed the value of nature in all decision making. If you can do that, we can then find a way to get the policies that we need, and critically also the funding to deliver the changes we need for people's mental health in the future.
Thank you so much. Well, that's it, folks. Thank you so much again to our wonderful panel. I'd like to thank Dom Higgins from the Wildlife Trusts for helping us to put together the panel, and for all the work he does in this area. He's a real hero. And thanks to everybody who's joined us for this important conversation. Mental Health Awareness Week is a brilliant and hugely important week in the calendar every year. It's been fantastic to be a small part of it this year, and I hope that everybody enjoys the rest of the week. I hope that it's highly successful, and wish you all very well, and thank you again for joining us. Bye for now.